Okay, so what if I told you that for decades, our entire healthcare system has kind of been paying for the wrong thing? I mean, not for health, but for activity. Today, we're going to dig into a huge shift that's changing all of that. It's called value-based care, and really, it's all about rewarding health, not just healthcare.
To really get where we're going, we first have to understand where we've been. See, for the longest time, healthcare has run on this really simple but, well, flawed idea that more is always better. But is it really? I mean, are more tests and more procedures always the best way to get healthier?
All right, so let's get right to the heart of the problem. For decades, the system has had a serious volume issue. It's been all about rewarding quantity, not quality.
And the engine that's been driving this whole thing? It's a model called fee-for-service. The name kind of says it all, right? A provider does a service, a test, a procedure, a visit, and they get a fee for it. Sounds straightforward, but the incentives it creates, well, that's where things get messy.
And here's the real kicker. When you pay for volume, you get volume. This model basically encourages more tests, more procedures, and yeah, sometimes treatments that aren't even necessary. So we see costs just going up and up year after year, but are we actually getting healthier? The answer, a lot of the time, is no. The whole focus is on doing more instead of achieving more for the patient.
So if paying for volume is the big problem, what's the solution? Well, it's a total 180, a complete shift in focus towards value. And this is where we introduce the whole concept of value-based care.
And the difference here is, well, it's night and day. Fee-for-service rewards the sheer number of things done, but value-based care, it just flips the script completely. The main goal becomes the quality of the outcome, and the incentive is to make a patient healthier, but to do it efficiently. We're moving from asking, how much can we do, to how healthy can we make you?
So what is value-based care when you boil it all down? It's a model that connects payments directly to the quality of care. It rewards doctors and hospitals for being both efficient and effective. To put it really simply, it pays for keeping people healthy.
You know, Michael Porter from Harvard really nailed it with this definition. He said value is about the health outcomes you get for every dollar you spend. And that really highlights the two big goals here: improve patient health, for sure, but also make the whole system more sustainable. So, who actually gets something out of this massive shift? The promise here is that it's a win for pretty much everyone involved. So, let's see if that's true. It turns out, when you align the incentives, everybody really can win. For us, the patients, it means better health and more coordinated care, often for less money. For providers, they get rewarded for doing what they got into medicine to do in the first place. You know, make people well. And for the whole system, it means better cost control and a real focus on efficiency.
But of course, a change this big is never easy. It comes with some pretty significant roadblocks and some serious challenges to get it all working.
Yeah, getting this right is a huge undertaking. First, you've got the cultural shift. You have to move an entire industry away from that more is better mindset. Then there's the data. You need really sophisticated IT systems to actually track outcomes. The model also shifts a lot of financial risk onto the providers, which is a heavy lift. And maybe the biggest question of all, how do you even measure value or quality? It's just incredibly complex.
But here's the good news. Despite all those challenges, there are organizations out there proving that this can be done, and the results are pretty incredible. So let's take a look at value-based care in action.
So first up, let's look at Geisinger Health System over in Pennsylvania. They put in place this really patient-centered model that focuses a ton on coordinating care and on prevention.
And the results? Get this. By focusing on keeping patients healthy and managing chronic diseases before they get bad, they saw an 18% reduction in hospital admissions. I mean, that is a huge number. That's thousands of people who got to avoid a hospital stay.
And it wasn't just about better health. They also saw almost an 8% drop in total medical costs. Better care that costs less? I mean, that's the whole definition of value right there.
And this isn't some one-off fluke. Check out Advocate Healthcare. They used what's called an Accountable Care Organization, or ACO. That's basically where doctors and hospitals team up to coordinate care. They managed a 20% cut in hospital admissions and saved a staggering $61 million in 4 years. This proves the model isn't just a theory, it's repeatable and it can scale.
So what's next? Where do we go from here? Because this is not a static idea. Let's look at where value-based care is headed and, what it means for the future of your health.
The future is all about getting smarter and way more personal.
We're already seeing things like AI being used to predict health risks and telehealth making care easier to access. There's also this growing focus on what are called social determinants of health, things outside the clinic, like whether you have access to healthy food or stable housing that have a huge impact. It's really about treating the whole person, not just their symptoms.
This has been a slow and steady journey. It didn't just pop up overnight. It really got a boost with the Affordable Care Act back in 2010, and later laws just accelerated the shift. The direction is crystal clear. Value-based care is on track to become the new standard for everyone. Which leaves us with one last, and I think really crucial question. This whole shift is built on data and technology and smarter incentives. So, as our healthcare gets smarter, will we as a society finally get healthier? The promise of value-based care is that the answer can be, and absolutely should be, yes.